My name is Dr. Hussain. I'm the Genevieve Touton Professor of Medicine in the Division of Hematology Oncology, the Department of Medicine, and the Deputy Director for the Robert H. Lurie Comprehensive Cancer Center of Northwestern University Feinberg School of Medicine. So one of the critical questions in oncology is the early detection and screening. And so family members, specifically females, there are national and international guidelines with regard to breast cancer screening. With prostate cancer, the field has evolved and we're sort of moved from screening to early detection. And just for a subtle distinction is that screening is basically you're going to apply a specific test to all potential comers of a specific, say, risk criteria, as opposed to early detection where you're really tailoring the decision as to whether to do something or not to do something based on the individual patient, their age category, their potential life expectancy, and other potential factors. Now, the guidelines have shifted significantly from doing a PSA on every male that was above a certain age to actually prostate cancer early detection. And there are several guidelines that I'm going to just describe briefly what the sort of the essence of it, because they all are relatively speaking in agreement. And these come in from the American Urologic Association and also the National Comprehensive Cancer Network expert opinion. So basically, the general guidelines are the following. If you are under age of 40 or under, then there is, at this point, there is no need to do any PSA early detection or screening. There is no reason. Now, I want to qualify one thing, and that is, like anything else in a bell-shaped curve, there's always outlier situations. And in my experience, I have encountered several men who are under the age of 40, who in fact had an enlarged prostate, and they were evaluated and a PSA was done, and it just turns out that these patients had prostate cancer. So the point here is this, is the implication is that if you have no symptoms, there's no abnormalities on physical exam and so on, then clearly there is no reason to do a PSA, generally speaking, in men 40 or under. Now, there is the American Urologic Association and similarly the NCCN guidelines and so on. There is a lack, or the panels do not recommend routine screening in men between 40 and 54 years of age. And the point here is this, is that's not for every male, and I will qualify that by saying, so men who are under age 55, who are at higher risk for prostate cancer because of a strong family history of cancer. Let's say the mother had breast cancer, the father had prostate cancer, or in fact, there is a higher risk because of genetics that have been tested, and the individual may have the BRCA genes and so on. This would be a situation where discussions will need to be made regarding the potential for testing. Now, for men between 55 and 69 years old, and this would involve benefit risk and clearly discussions. And what's critical here is the fact that any patient who doesn't have a long life expectancy because of other comorbidity, then obviously there's no point in doing a PSA detection. So somebody who has, let's say, a leukemia and they are 55, this is not a person that should go through routine PSA testing just for early detection. The point here is, again, for the average population, 55 to 69, a shared decision is the recommendation between physician and the patient, and then proceeding with the testing. Now, the greatest benefit of screening appears to be, again, basically in this age category of men. Now, to reduce the harm of repeating the blood test yearly, The interval that has been recommended roughly is somewhere around 2 years. And I would recommend, again, discussions with your doctors regarding the frequency of screening and how long to keep continuing and doing it. There are, again, as I mentioned, the recommendation is not to do routine PSA early detection in men who are above 70 years old, or those who have, again, a shorter life expectancy. One of the issues that I think is very critical is what sometimes, again, I encounter because, again, the guidelines are general guidelines, but it's important to interpret them within the context of the individual patient, so the individual man that one is seeing. And so one thing is PSA normally, again, PSA is prostate-specific antigen. It's made by the prostate tissue. And as men get older, their prostates get bigger. And so potentially the PSA can get higher. And so it's very important to understand that there's what we call age-adjusted PSA. So somebody who, let's say at age 55, their PSA level is not likely normally to be, say, 3.9, whereas somebody who might be 75, it could be 3.9. And so the point here, it's important to adjust for the age, and not one value is enough, meaning one value is done. If it looks within the normal range and within the age expectation, that's perfectly fine. But if a test was done and appeared to be elevated above the normal range or above what is expected or appropriate for the age group, then the recommendation is to repeat the test again, just to confirm that there is the elevation is there, and then consequently afterwards undergo evaluation, generally with urologists, to discuss pros and cons and merits of biopsies and additional testing in terms of prostate health index and so on, to determine, an MRI to determine, and an MRI, I'm sorry, to determine the next steps in management.